I've got Dr. Michael here, and we've been talking about plastic surgery. And before the break, we did share, I think I sort of shared how I had this notion about what plastic surgery is, and I think even where plastic comes from, why the name plastic, I think that goes to create a skewed perspective of what this industry is about, your industry is about, that it feels very unreal and fake. But I remember in high school, I remember the moment in which I thought, I knew very clearly that this isn't what I thought it was, and it was someone I knew who ended up getting breast surgery, but it was breast reduction because she was A, very self-conscious, and B, she had back pains, and I remember that was the first moment I thought, it's not as black and white as you have to be so rich and self-absorbed, period. But there's different layers to it. But I do want to understand the aesthetics world a little bit more. So in your experience, in the 5 years that you've been practicing, what's the most asked for surgery, or what surgery have you performed the most times? And typically, of clients that come into your practice?
If you don't mind, I'm going to start with the second question first.
Okay.
But I'm just going to do that because I think that'll also break a few stereotypes.
I think
so.
So
The interesting thing is this: like in my personal experience, and different surgeons will have slightly different viewpoints on this, but in my personal experience, the majority of the patients I have treated are, for all intents and purposes, regular 190.
Okay.
Now, what do I mean by that? I mean literally people who do everyday jobs. In fact, if I were to look at my own logbook, it's probably the majority of patients I've treated, and I did a lot of hand and microsurgery, and that's something I'm passionate about, were actually factory workers. So people who mistakenly, accidentally get their hands caught in machines, or are dealing with, for example, the automated slicing equipment in butcher shops and stuff like that, and end up with injuries as a result. Now, numbers-wise, those are patients we forget about because they're never in the media, they're never talked about, but those are the patients we're dealing with, in large numbers every day. So by and large, I would say that percentage-wise, 80-85% of the patients I've dealt with both in my training and as my sort of young specialist career, and even now, are probably those sorts of patients.
Right.
Every day, regular sort of Joes from every walk of life.
Okay.
When you going back to your first question, which is which operation do you think you've done the most of? Now, because accidents and injuries can be so varied, many of them are quite unique. I mean, if you were to put hand injuries into one group, I'd probably say I've done more hands than anything else.
Okay.
But if you were to talk about one prescribed operation that I've done the most, and this is probably because I lived, worked, trained, and now I'm back still in a very African setting. It goes back to what you just described, which is breast reduction.
Breast reduction?
So, yes. So in our setting, in our African setting, it is such a common problem, okay, that by and large, I think most plastic surgeons have trained in our environment. That'll rank right up there in the top 3, maximum top 5 procedures that they do.
I did not think it was reduction. I thought you were going to say enhancement. The implants, the lifts, the what. Wow.
So yeah, and as you alluded to, the reduction part of breast surgery is mostly not very cosmetic, in the sense that patients aren't seeking out primarily because they want to look a certain way, or they want to portray themselves or change the way they look. They're actually functionally suffering. They're having back pain. They're having bra straps that are cutting into their shoulders. And in many cases they've struggled with this for years, if not decades. It affects everything: self-confidence, the ability to work out, the ability to find just clothes, regular clothes off the rack that fit. And so it really is a debilitating and common problem. And I think so most African trained or African based plastic surgeons would tend to be doing very many breast reductions.
So I've shared, one of the misconceptions I had, and how the moment in which I thought, it's not as black and white. So I want to share a few more, and I hope that you can debunk these myths or misconceptions. The first one is that you can get addicted to plastic surgery. and specifically, the cosmetic.
Yes.
Yeah.
That's an interesting one. I mean, I think to some extent that probably is true, and I say that because today we know that addiction, I mean that term, is a bit broader than what we used to think about it 20 years ago. So 20 years ago, it was assumed to be addicted to something, anything. It had to have it had to be a physical chemical. It had to change something in your mind, And so the things we talk about were drugs and alcohol. And really tangible stuff.
Right.
But today we know that you can get addicted to many things. Social media, work.
Yeah.
The people who literally cannot pull themselves away from their work lives. Sex.
Yeah.
Okay. And I don't mean the physical aspect of that, but just the mental aspect.
Yeah.
So in the same way, some people do get addicted to a certain look or a certain sort of
perspective, like
yes,
pervasive
absolutely.
idea of who
and some of the things in our environment are unfortunately expanding or promoting that. And so, for example, unnatural, unhealthy themes in social media and in advertising and so on are pushing that image. So, for example, having young, skinny models showing off
tiny little waist,
clothing,
big curvaceous.
Well, yes,
behind.
Exactly. So all these sort of unnatural or very rare sort of physiques and so on that are being portrayed as being the norm will not help that sort of perspective. And then obviously, I think there's always a component of the person coming into that problem.
Yeah.
So some people are more prone to getting hooked, in quotes.
Right.
So for example, you've got, and this is in every walk of life and in everything we do. I mean, there are people who are reasonable about what they do, how they eat, and so on. Yeah. And then there are people who kind of, are on the extremes. Yes. So you'll find people who get something done, and then though they might not even mention it to the surgeon initially, they want to keep going down a path that makes them look like their perception of perfection.
Yeah.
Now sometimes that can be very flawed. And to the point where it can even be a psychological disorder called body dysmorphic disorder.
Right. So in a case like that, if you have a patient who's come in 6-7 times, as the plastic surgeon, can you say no? Can you turn them down? And is there ever psychological evaluation of the patient before they go under the knife?
Absolutely, good question. Because I think in terms of our modern training, we're actually warned to take a very careful history and assessment the very first time. So in fact, to try and avoid that problem, we should be looking for these problems or hints of them on the very first assessment, not seven down the line. But yes, the seventh time could happen because you might be the seventh person being seen, not the first.
Yeah.
You see, somebody could have gone to other surgeons and gotten things done, and by the time they come to you, you're not the first, and it's not the first procedure.
Yeah.
So yes, so it should wave red flags. It should ring alarm bells.
And you do have that psychological evaluation.
Yes. So one of my mentors always used to say, you've got to have a friendly neighborhood psychologist close by, and be able to very gently get an assessment, because obviously some patients are not going to be happy being told, you need to see a psychologist.
Yeah, it's like, I'm coming to get my boobs done, and you're like, no, actually you need to see a therapist. I'd be like, what does that mean? But at the same time, if I came in and I said to you, hey, Dr. Michael, I've been seeing all these great, beautiful Instagram models, and I want to have this exact same body, and I want you to make me thin at the waist, thick here, very light skinned.
Yes.
If you think it's not a healthy reason or a good enough reason, can you say no?
Absolutely. And in fact, personally, I say no a lot.
Okay. Really? Okay.
If it's something unreasonable, I say. I think I turn away a lot of patients. Not turn them away completely, but just try to spend a bit of time refocusing them on reality. So what does that mean? That means going through what they're looking for, breaking it down, and saying, look, going to happen. I mean, if you're, for example, if you're very dark-skinned, African descent, and you want to look completely, almost Caucasian in your skin color, that's not going to happen safely.
But I mean, there's like examples online about of women and men, but women who've changed drastically.
Yes. But in the majority of cases, wherever there's a drastic or dramatic change, it is almost always, it comes at high risk. Let's put it like that.
All right.
And so that's the first thing to sort of make clear that, look, I mean, some of these things might be possible. You might even see surgeons having done these procedures elsewhere in the world, but by and large, most run-of-the-mill plastic surgeons around the world who are safe will not offer you, certain things. So the first is sort of setting that groundwork and making sure that we know what the patient's expecting and what's possible. And then also, one of the things I spend time immediately with this is trying to make it clear that, look, I mean, for example, Kim Kardashian, reputedly has had lots of procedures done, but the truth is, if you go and look at a young Kim Kardashian at like 16, and you look at what she is now, yes, certain body parts might have changed shape, and that could be aging and hormones and all the usual normal parts of life, and yes, some of it might be plastic surgery, but by and large, certain sort of bits of your, for example, your skeletal framework, your body shape and size and habitus don't change much. So what I'm trying to say is, like, if you came and said, I want to look like somebody who's completely a different body shape or size, I'm going to tell you very early that, look, that's not possible. We can make you look the best version of you, but it's going to be impossible to safely go.
So a warning sign already for you is if I show you a picture like, make me look like this, and you're like, no, that's not.
That's
not what we do.
So I don't get too upset with that, because again, patients unfortunately are bombarded with all these images from social media. So just showing me a picture doesn't mean that they're being unrealistic. But if
we're trying to show you this is the kind of thing I want to look like.
So if we can tease out what they want from the picture, and make it clear that, look, I mean, it's not, we can't make you look like the picture, but we can get, for example, your waist closer to this lady's waist, and you're okay with that, then we can discuss this.
So I don't know, that you see, that's the part where I start to get a little uncomfortable about, like, this whole world. How much of social media do you think has affected plastic surgery and
a lot.
Really,
a lot. Like, I'll give you a simple example. I mean, there's many. There's numerous examples, but one of the simplest, and one that was actually documented and researched and published on, is how social media and selfies, looking up into a camera held above the level of your face, increase the number of nose and lip augmentations and changes that patients came in looking for. And the reason for that is because, as you can imagine, and your cameraman will tell us this as well, your distance from the camera, your focal length changes how your face appears. It distorts how your face looks. So if you're looking into a camera at close quarters, the closest thing to the camera lens, which is your nose and your lips, and in the midline, are going to be slightly enhanced just by that sort of fisheye distortion. And so when people started doing this, what started happening is that when people take a picture, like a regular sort of studio shot from standard distances, they'd look at those shots and they look at their selfies and say, hang on, but I mean, my selfies look so much better, it's actually not. They're the same person, nothing's changed, but there's the distortion.
Angle. Are you telling me that selfies increase the number of people going in for nose jobs and lip? What is it?
Enhancement or filler or exactly. So a lot of patients,
and some Kylie Jenners here and there with like examples and seeing these images of what.
So you see, if you want to always look a certain way, then you want to change that body part permanently. And I'm just giving that I'm using that example because it's something I think everyone can relate to. And it actually did change, the sort of the numbers of patients seeking those particular procedures, every month or every week.
Selfies.